Doctors are calling a new drug treatment for obesity a game changer, and the timing could not be better because researchers know that being dangerously overweight can increase the risk of COVID-19 complications. An existing type 2 diabetes drug developed by Novo Nordisk is now being hailed as a breakthrough treatment for obesity.
I think that for patients, this will be a significant, game changer.
Researchers at Northwestern University studied the drug semaglutide at much higher doses on people with obesity. Almost 2,000 volunteers in 16 countries participated. One injection a week for 68 weeks. The New England Journal of Medicine published the results showing those in the drug group on average lost almost 15% of their body weight with minor side effects. The placebo group lost 2.4%.
And here's the game changer. 1/3 of patients who got the drug lost at least 20%.
Other obesity drugs right now result in 5 to 10% weight loss. Semaglutide is a synthetic hormone that controls appetite.
It goes to the brain and it helps you feel full. It increases fullness.
With me now is Dr. Jannine Kyrillos. And she is one of the area's leading weight loss experts. She is director of Jefferson Weight and Metabolic Health at Bala Cynwyd. Doctor, thanks so much for being here.
Thanks for having me.
So the last doctor we saw in this story is on the advisory board for Novo Nordisk. She's excited about the drug. What's your take on this drug?
I'm very excited about it. We try very hard to treat obesity with several different aspects, and the data on semaglutide, this medication, has really been robust. Just having something else in our armamentarium to treat patients is great. And the data in the trial that just came out is superior than any other medication that we have.
Let's talk about that. There are a lot of other treatments. You said you use a variety of treatments for obesity. Do they all work the same, and why will this drug be different?
So there are several medications that are FDA approved for obesity. They all work differently. Some work on the appetite, some work on the glucose insulin metabolism, some work on absorption. There is one medication that exists currently, liraglutide, which is similar to semaglutide, and that's been around for maybe the past 5 or 6 years, and has been very, very helpful for patients. What's nice about this newer medication, not only is it just seem to have more robust weight loss, but it's a once-a-week injection versus a once-a-day injection for the prior medication that was similar to it. So it's much easier for patients to digest. Once a week I can think about it, put an alarm, do it once a week and then be done.
What do we know about the side effects?
So most common side effects are, gastrointestinal, nausea. One of the main way it works is to decrease your appetite. So if that works too much, then you get some nausea. Sometimes you can get some reflux. You can get some diarrhea, constipation. Those are the most common. There are some very rare complications that happen rarely, like any medication.
Right. Who would be a good candidate for this? Must you be truly obese? I mean, what's the level here?
Okay, so these medications are indicated for people who have a body mass index of 30 or of 27 with an additional obesity-related or weight-related condition, which could, be many things. It could be hypertension, diabetes, prediabetes, joint pain, really a lot of different things. So body mass index of 27, so that's somebody who's overweight. Obesity starts at body mass index of 30.
And would you have to be on it forever?
So we do look at anti-obesity medications as long-term. When somebody starts a medication for blood pressure, when their blood pressure gets normal, they don't stop it. They continue it to maintain it. So a lot of the studies show that if people stop taking the medication, then they tend to gain the weight back. There's no cure for obesity. It's just, unless you can beam somebody back, hundreds of years or live on a desert island, we're surrounded by the things that are causing obesity, and so there's no cure. So these medications can help, lose and maintain a significant amount of weight, which doesn't have to be a very large amount. even losing 5% of one's body weight can make a big difference in their health.
Let's talk about the cost. I understand as high as $1,000 most insurers won't pay. Would people who are in need of that, would that make it impossible for some to pay?
Yes, it would.
Yeah.
So that's a big struggle. It's a big problem that, obesity isn't really considered, we all know that it's a big public health problem.
Yes.
But the insurance companies often don't include anti-obesity medications in their basic plan. So when the employer makes a contract with the insurance company, they have to pay extra for a rider to cover obesity medications. So they can opt out of obesity meds, and then employees are not covered. So I have so many patients that, and Medicare and Medicaid do not cover it at this point in Pennsylvania. There's so many patients that would benefit from these medications and really just can't afford them.
Right. Well, we know COVID-19 has doctors taking an even harder look at patients who might be overweight, now that we know obesity is a risk factor for serious complications. If someone who is watching today says, all right, I'm going to admit it, I really should lose some weight, what's your best advice?
To approach it systematically, to see a healthcare provider that can help them, or and not think that it's only on them. Obesity is not a character flaw. So there are treatments. There are dietary treatments. We're understanding more and more about diets and carbohydrate intake and how they affect our insulin levels. A lot of the original nutritional advice that we've been giving people, low calorie, low fat, 6 small meals, that's not working for the majority of people. So really teaching them how to eat differently, how to nourish bodies in a way that is sustainable. Medications at an earlier time, patients shouldn't have to fail to get a medication. Oh, well, you didn't try hard enough, so you can't get a medication. We should just treat them right off the bat with these medications, and surgeries are, unfortunately, we live at a time where there aren't better treatments, and we need to do what we can.
Yeah, seek medical advice, seek help, right?
Yeah.
Dr. Jannine Kyrillos, thank you so much for being with us, Director of Jefferson Weight and Metabolic Health at Bala Cynwyd. Thanks.
Thank you.